Years ago, my mother, Hope, had what was called a nervous breakdown. She had clinical depression.
It can affect children, adolescents, adults, people in late life, in every social strata, in every walk of life, of every race, gender. In the United States, between the ages of 15 and 45, depression is the single leading cause of disability. The economic cost of depression is huge. This is not an illness that just occurs in Western European society. It is a worldwide illness. There is nothing that can give you immunity from depressive illness.
My family and I witnessed years of misdiagnosis and medication basically given by trial and error. As my mother's patient advocate, I was told the startling reality that in the 27 years since the introduction of Prozac, a serotonin-based medication, there has essentially been nothing new in the field, just variations of basic serotonin and norepinephrine antidepressants, and those are just 50% effective.
There really has been no new treatments on the horizon for over 20 years.
With the staggering statistics and the need for new treatments in mind, in 2006, and in memory of my mother, I started the Hope for Depression Research Foundation with a mission to fund cutting-edge research at an accelerated pace. In its initial 4 years, HDRF has funded over 100 grants in 12 countries, in 18 US cities, and at 48 research institutions, such as Stanford, Yale, and my alma mater, Tufts.
The way that we're going to develop new, effective, and innovative treatments is by understanding the brain physiology, the location in the brain, the neural networks in the brain, the neurotransmitters in the brain that are important and critical to the development of depressive illness.
From the beginning of HDRF, I wanted to create a major think tank where top minds in science could come together and to really form a plan of what was missing in depression research, and then to execute that plan in a collaborative effort.
One of the problems with standard research is that it's a slow process, a bureaucratic process, an underfunded process, and one that promotes competition between researchers and not collaboration.
Thus, in 2010, the Depression Task Force was formed, made up of leading neuroscientists, each a pioneer in their own field.
What HDRF does uniquely is to bring together 8 world leaders in depression. Each of us are focused on different aspects of neuroscience of depression.
We're actually studying multiple models, multiple perspectives at the same time in ways that can interact, feed off each other, and really answer questions that have been, plaguing the field for years.
Lots of drug companies have given up on it. We need new ways of thinking about it. We need new targets. The DTF has just this kind of amazing, magical combination of people who are all confident in their own work, but also eager to find a bigger truth, if you will, by coming together, working together, sharing information.
All of us on the DTF contribute our data as soon as it's accumulated. Sometimes it can take several years from the time it's accumulated to the time it's published. That means we are sharing data years in advance of when the rest of the world would see it.
What's actually emerged is that there is synergy. There's a chemistry, there's a trust.
The whole is definitely greater than the sum of the parts.
And now here we are 2 years later, where individuals are presenting ideas that wouldn't have emerged without this synergy.
So for example, recently we discovered a novel pathway that may be interesting for the development of novel antidepressants.
We're honing in on what things are necessary and sufficient. I can't think of any organization or any kind of formal granting process that works to enable people in this way. We're going to really start to see what's possible as we go into the next few years.
Every donor at HDRF joins this unique partnership with top neuroscientists. Without the support of our donors, HRF would not be able to provide urgent leadership in this depression research field. And every donor should know that 100% of their gift goes directly to this breakthrough research. Although doctors couldn't find the right treatment for 100% of my mother's psychic pain in her lifetime, I am confident that in my lifetime, with our progressive research and out-of-the-box thinking, we will be able to find the root causes of depression, new and better treatments, and ways to prevent depression, providing hope and help to millions worldwide.
This is fun. This is science. This is collaboration.